Hi there, this is Andrew with Zang Physical Therapy here, and today I want to talk about dizziness. Dizziness is something that is quite prevalent in our population. At least 5 to 10% of people deal with dizziness or vertigo on a routine or regular basis. And this number seems to grow as the individual gets a little bit older. And sometimes this is associated with the aging process, but in other cases it isn't specifically an aging problem. Sometimes it could be a neurological issue. Sometimes it could be a vascular issue. A blood flow issue to the brain could cause dizziness. Sometimes neck pain could even cause dizziness. But another thing that can sometimes happen, and oftentimes this happens for no reason at all, something like positional dizziness or positional vertigo. The acronym is BPPV. Again, it's positional vertigo. It's nothing dangerous or harmful in itself. Like most dizziness is fairly benign on the scheme of things, so long as you're not falling. So that's one of the big things. A lot of people will experience dizziness and then sustain a fall, and then some injury happens as a result. So what I want people to think about is, if you are somebody with dizziness, that you get the issue looked at and hopefully treated before it leads to a fall, because bad things happen with falls. So if we can do anything we can to prevent it, we certainly want to do it. So if we talk about positional vertigo, there are some very specific positions and treatments that can be done to help alleviate that issue. So again, people may have heard about the crystals or rocks in the ear. That's something that happens, and as people roll over in bed or sit up from bed, look down to tie their shoes. Those are types of things that are very highly related with positional vertigo, and again, can be treated very, very easily in just a few sessions. If the dizziness happens associated with neck pain, then that's the person who's going to want to get treatment for their neck pain. Multiple means that could accomplish it, but you need to treat the source, not just a symptom of dizziness. If it's some kind of cardiovascular issue, then that's something that, every time you exercise, you get dizzy. That's a conversation to have with your primary care doctor or a cardiologist or somebody like that if they've already been tracking you, because there may be some issue there that they can address with medication and or diet or changing how vigorous you might exercise. So certainly talk to the appropriate person right there. As for neurological conditions, there are various things that happen. Again, the first consultation certainly with could be your primary care doctor, could be a neurologist. Along the way, you might interact with a physical therapist because you think it's more the benign positional vertigo. But in any case, we want to try to determine the source and then treat that, because we don't want the symptom, the dizziness, to lead to falls, broken bones, hospitalizations, going to nursing home for people who are older. That's not something that we want. So I'm always amazed the number of people I'm treating for, say, shoulder pain, and we'll lay them down and I ask them to turn over and they're like, hold on a minute here, I'm worried I might get dizzy. A lot of people walk around with dizziness and just don't know that it can be treated. So if you have dizziness, if you know someone who lives with dizziness on a regular basis, then share this message with them and know that treatment is available by some medical means. It doesn't always mean that you need to take a pill. Again, some things can be treated very, very well with some hands-on treatment, some positioning of the body and head to clear some things out. So it's nothing to be afraid of. It's something that if you're tired of being dizzy and you're ready to be treated, there are professionals out there who can help you get undizzy and really improve quality of life for people who become scared to move, especially if you've sustained a fall because you became dizzy. So please stop letting dizziness impact your life in a negative way. Go get checked out by your doctor. Ask for a referral to somebody who can treat dizziness specifically, because it is something that can be treated very, very successfully. If you have any questions, put them in the chat. Send me an email, andrew@zangpt.com. I look forward to continuing this conversation and continuing to work with people who have dizziness, get back to living the life that they want to live. Have a nice day.